and welcome to PharmaZ's Pharmacy Teaching Videos. These series of videos are focused on minor ailments, so common conditions treated with over-the-counter medications and advice, and today we'll be discussing hay fever. Before we start, it would be really helpful if you could like and subscribe to our YouTube channel, and remember to turn on notifications to be informed of new video releases. Also make sure you follow us on Facebook and Instagram for posts and quizzes. Allergic rhinitis is an inflammatory hypersensitivity reaction which occurs when the membranes lining the nose become sensitized to allergens. It's known as seasonal allergic rhinitis when symptoms occur at the same time each year, such as the spring or summer. If it's caused by grass and tree pollen allergens, it's also known as hay fever. Tree pollen tends to be around in the springtime, whereas grass or weed pollen is usually around in the summertime. Persistent or perennial allergic rhinitis is where symptoms occur all year round and is mainly due to house dust mite or domestic pets. Other triggers also include pollutants such as tobacco smoke and car emissions. Allergic rhinitis is associated with asthma and eczema. Symptoms typically consist of sneezing, nasal itching, nasal blockage, and watery nasal discharge. Eye symptoms such as bilateral itching, redness, and tearing are also usually associated with allergic rhinitis. Other symptoms may include cough, tiredness, a pressure sensation in the head, as well as generalized itching. Other forms of rhinitis include occupational rhinitis due to airborne substances in the workplace, non-allergic rhinitis, which is a response to environmental factors, hormonal rhinitis, which is associated with pregnancy, puberty, oral contraceptives and conjugated estrogens, and infectious rhinitis. In terms of referral, refer the following: nasal blockage in the absence of rhinorrhea, nasal itch and sneezing, and in these cases there should be a referral to the GP for examination to check for nasal polyps, deviated nasal septum and mucosal swelling. If there's unilateral nasal discharge, especially in a young child, they should be referred to check for a trapped foreign body. And if the patient's symptoms are not controlled with treatment, then they also should be referred to their GP. Moving on to over-the-counter treatments for hay fever. Oral antihistamines reduce rhinorrhea and sneezing, but are usually less effective for nasal congestion. People needing to concentrate, such as on driving or sitting exams, should avoid sedating oral antihistamines such as chlorphenamine or promethazine. Non-sedating antihistamines such as loratadine, cetirizine or acrovastin are more appropriate choices in these instances. The age and weight of children must be considered when selecting products, but all antihistamines appear to be equally effective. First-generation antihistamines, otherwise known as older antihistamines, such as those we've highlighted as being sedating, block both histamine and muscarinic receptors as well as passing the blood-brain barrier. Second-generation antihistamines, also known as the newer antihistamines, which are non-sedating, mainly block histamine receptors and don't pass the blood-brain barrier. Side effects that are more common with the older antihistamines include headache, psychomotor impairment, and antimuscarinic effects such as urinary retention, dry mouth, blurred vision, and gastrointestinal disturbances. Drowsiness is a significant side effect with most of the older antihistamines. Rarely, paradoxical stimulation may occur, especially with high doses or in children and older people. Drowsiness may diminish after a few days of treatment and is considerably less of a problem with the newer antihistamines. Oral decongestants, such as pseudoephedrine, in combination with an oral antihistamine, have been shown to be effective in treating nasal congestion associated with hay fever. Common side effects of the combination are headache and insomnia. However, please note, as per MHRA guidance, there are restrictions for the sale of pseudoephedrine and ephedrine over the counter, due to their potential for abuse in being extracted in the manufacture of methamphetamine or crystal meth. So pack sizes of over-the-counter oral pseudoephedrine is restricted to 720 mg, and for ephedrine it's 180 mg, and there is a limit of 1 pack per customer, no combination of products to be bought at the same time, and the sale is recommended to be carried out by a pharmacist. Intranasal corticosteroids can be used to treat more persistent hay fever symptoms or associated nasal congestion. Where rhinitis is a main symptom, intranasal corticosteroids should be the first-line choice as they are more effective than oral antihistamines in reducing total nasal symptoms, particularly nasal congestion and sneezing, and can improve eye symptoms. To prevent symptoms, the spray should be used before exposure to the allergen, typically 2 to 3 weeks before the hay fever season commences. Intranasal corticosteroids have similar clinical efficacy to each other. They have a slower onset of action than oral antihistamines, and patients should be advised that it will take a few days before maximum efficacy is achieved. The spray must be used regularly throughout the season to maintain benefit. Intranasal corticosteroid side effects are mild and localized and include dryness and irritation of the nose and throat. Beclometasone, fluticasone, triamcinolone, and budesonide nasal sprays are currently available without prescription and can be sold to adults over the age of 18 years for a maximum period of use of 3 months, after which GP consultation is recommended. And finally, sodium chromoglycate is a mast cell stabilizer available as eye drops. It's effective for ocular symptoms. Contact lens wearers should be advised that their contact lenses may exacerbate their eye symptoms and may not be suitable with use of the eye drops. They should be advised to visit their optometrist or use glasses whilst they have symptoms. In terms of pregnancy often exacerbates rhinitis. Allergen avoidance should be the first step if that is possible, as most manufacturers of antihistamines advise avoiding their use during pregnancy. If symptoms become unbearable, topical treatments, such as nasal sprays or eye drops, are the safest to use as systemic absorption is minimal. Also, just to note, management of persistent perennial allergic rhinitis is the same as seasonal allergic rhinitis, but some over-the-counter products may only be licensed for the latter, so just check products before supplying them to the patient. And finally, self-care advice. The NHS recommends the following advice to people who have hay fever. Put Vaseline around your nostrils to trap pollen. Wear wraparound sunglasses to stop pollen getting into the eyes. Shower and change your clothes after you have been outside to wash pollen off. Don't dry clothes outside as they can catch pollen. Keep windows and doors shut as much as possible. Vacuum regularly and dust with a damp cloth. Also, it may be worth buying a pollen filter for the air vents in your car and a vacuum cleaner with a special HEPA filter. Don't keep fresh flowers in the house. And don't smoke or be around smoke, as it can make your symptoms worse. Of course, ideally allergen avoidance is advised, but it isn't always practical. Pollen counts are issued during the summer and might help a patient decide when outdoor activities should be avoided or windows kept shut at home, or when to take an oral antihistamine if they are only taking it when required. So that's all for our hay fever video. I hope you found that useful. Please remember to like and subscribe to our YouTube channel, turn on those notifications, and follow us on Facebook and Instagram for posts and quizzes related to this topic. Thank you.